with dealing with the situation. What can we do to assist you to resolve the problems that we are struggling with? Um, how can we build confidence that we can reach our goals or our targets and set the targets or the objectives so that people know what they're working towards? A little goes a long way to improve communication and generate ideas. And then I found this, how to have a lovely day, just by smiling, by slowing down a little bit, by saying thank you and giving compliments. I think now in COVID-19, we sometimes forget to dress nicely. I dressed very nicely for today because it made me feel better and give me confidence to present this. Observe and listen to others. Be charming, laugh, wish others a lovely day. Positive framing, highlight what can be done, suggest alternatives and choices. Avoid negative words, words like cannot, will not, unable. And if you start to listen to your own talking, you will become aware that we use a lot of these. For example, instead of saying this cannot be done if you do not provide ABC, if you can provide ABC, we can complete, we can reach the target and the objective, but this is what we need. One more staff member with this and this qualification. Maybe then it can be done if we phrase it in the correct way. And that brings me to cognitive behavioral therapy. If all else fails, then go for a course of CBT. Or you can also get tips on the internet how to do it. And this is all about changing negative or overgeneralized thoughts or catastrophic thoughts into positive and into something that's more realistic. Instead of saying all of us will become ill because of COVID and many of us will not make it. How is that true? No, that is not true if we look at the statistics. So how can we rephrase it to make sure that we give people a realistic picture and don't create a negative atmosphere where people fail to reach their goals and they sort of become hopeless, anxious, depression, and they cannot reach their goals, they cannot make plans or be creative to overcome the things that they're struggling with during this crisis and the obstacles they're facing. Because our thoughts influence the way we feel. Sometimes we think that it's a feeling that came up, but there was a thought before that feeling that stimulated that negative emotion, and that influence our behavior and the way we react and respond to others. So a few tips. Recognize that the coronavirus pandemic will affect the way people hear, interpret, and respond. We are already stressed. We are already anxious. So we hear things in a different way. Sometimes we miscommunicate. Sometimes we get quickly angry. We can feel guilty. We can have lots of feelings that affect the way we respond. Don't deny the facts, but also don't catastrophize because that makes it worse for everybody. Focus conversations, whether they are about COVID-19 or not, on what you could do in a situation instead of what could happen. Focus on action. Be ready to adapt. We saw many organizations really adapted and came up with innovative ideas because they took action and they really thought deeply about what they can do to make it better for people. Focus on the facts. People now need facts. They don't need misinformation and they don't need secrets or hiding away from the facts. Acknowledge that this climate may be the new normal for some time and we need to adapt to this. Now is also a great opportunity for managers to roll up their sleeves and get into the trenches. That shows other people and employees that you're willing to participate and willing to go all the way with them. Practice humility. Leave ego at the door and do the work you need to make life easier for everyone during this time. Then it will become easier for you as well at your workplace, with your colleagues, and with people at home. Be open and transparent. Everybody is on edge, so prepare for this response and don't take it personally. And then I have some references, and I see that it's 11, so I will stop sharing because the load shedding might kick in any time. So that was my presentation. Thank you.
Thank you very much for that. That is Dr. Annetjie van der Walt, who is a lecturer at the Department of Nursing Science at the University of Pretoria. One question that came up during the Q&A, if you could just quickly again indicate what the abbreviation is. It let me just get that again. Is it CBT is the acronym?
CBT is cognitive behavioral therapy.
Thank you very much. And that's for Jacob de Villiers. Okay. So moving on, am I to understand that I'm now handing over to Prof. Haynes? Annetjie?
If she is with us, it might be that she's still not able to join.
Okay. Then I'm going to move on to our next presenter, and that is on the topic of moral injury and stigma. I think these are all very, very essential topics, important topics for us to deal with today, and we thank Dr. van der Walt for her contribution on the topic of positive communication. So our next presenter is Dr. Marshini Naidu, and she is going to deal with moral injury and stigma, and I'm going to ask her to just share her slides with us and give us a brief introduction.
Thank you, Ashraf. While Dr. Antoinette Myrick is sharing her screen, Dr. Marshini had a domestic emergency, and kindly, Dr. Myrick has kindly agreed to help us out, and she's going to do the same topic, but it's going to be done by Dr. Antoinette Myrick.
My apologies, I've not been keeping up with the updates in the program. So as a brief introduction, Dr. Antoinette Myrick is a MBCH Masters in, I think is that, terrible. I've got my abbreviation properly at Wits University and MEdS Psych at Wits as well. She runs a private psychiatric practice in Johannesburg, South Africa, and co-founder of the Health Workers Care Network that dealt with a webinar earlier on in our process, which launched in June 2020. And she has a passionate interest in the well-being of fellow healthcare workers. So welcome again. Thank you for joining us. I'm handing over to you.
Thank you so much. And it's really nice to be able to talk to this audience. I'm just going to start sharing my screen. So just by way of introduction, so my name is Antoinette Myrick, and I'm a psychiatrist, work in private practice. And what I'd like to encourage you is, if you've got any questions or comments about the presentation, please kind of ask away as we're going, and I will obviously come to them verbally, or I'll be able to write out an answer. So I'm one of the co-founders of the Healthcare Workers Care Network, and if you haven't heard of us, please go and have a look at our website. We are a pro bono volunteer mental health response to healthcare workers. Any level of healthcare workers within South Africa, so anyone who works in a healthcare setting, so cleaners, admin, support staff, up to doctors. And we have got two main aims of our work. One is a responsive and training arm, which is part of the presentation today. And the other part is that we are offering pro bono sessions to any healthcare worker in South Africa. They can sign up for the sessions on our website. or they can phone our helpline and they will be speaking to trained psychologists. We have over 600 volunteers on our network, so we really have a great response. What I'm going to talk to you about today, as I may not everyone is healthcare workers, but I will be referencing healthcare workers during the presentation, knowing that it fits with essential workers and generally anyone working on the front line. But a lot of the research coming from about healthcare workers actually applies to the general public. I'm going to talk about stigma, trauma, and specifically a topic which I'm quite passionate about is moral injury. So stigma is a really important topic, and I think not enough has been spoken about it. I think, obviously there've been kind of more pressing issues, practical issues, clinical issues, and as this says, viruses don't discriminate, and neither should we. Stigma will not fight the coronavirus. Sharing accurate information will. So I looked at a few articles, and I'm going to go through stigma just now, but just to see, I am hoping you'll see that some of these dates are from near the beginning, so May, April, June. I am hoping that the stigma has improved, but this is an example of it. Some community healthcare workers working in Natal are concerned about the rising levels of stigma, and angry residents burned tires outside a hospital where patients were admitted with COVID. This next one is, COVID-19 positive healthcare workers accused of carelessness, and I'm going to discuss this now when we talk about stigma. Mediclinic workers say that when nursing and support staff at one of Victoria's hospitals test positive for COVID-19, they're accused of catching it and being careless. Obviously, this is hearsay, but I know that this is happening. So what I wanted to speak to you is about stigma in the time of COVID-19. And I wanted to look at, sorry, just excuse me. Sorry, so stigma in the time of COVID-19. So the way I look at it is there are different types of stigma, and I'm going to talk through each of these. There's self-stigma, there's community stigma, and there's individual stigma towards others. Stigma towards self is the shame or embarrassment at having COVID, so having contracted it yourself. The community stigma is, as I said, stigma towards healthcare workers, stigma towards patients, and stigmas towards returning colleagues. Individual stigma is individual stigma towards others, and this is personal discrimination against others because of their COVID status or because they are healthcare workers, and this includes protests or avoiding people because they have COVID or because they work in healthcare. So when we start to think about self-stigma or internal stigma, a lot of this text and graphics are from a fantastic website called beyondstigma.org. And self-stigma and internal stigma is a concept which I think we know quite well from HIV. And it talks about when I start to think or say negative things about myself. This is a negative stigma. And I know, I've had a few exposure scares, and each of them I have felt, what did I do wrong? I can't believe I did this. What happens if I expose people? So there's automatic kind of blaming. I think it's important to know that if you have had or have COVID-19, that's exactly it. You're not COVID-19, you just have it. The other thing is to not take it personally. And this is quite specific. I think, if you have COVID-19 and you're self-isolating within your home, people are going to, stay away from you and, clean surfaces which you touch. And this is not necessarily, it's not about you, it's about the virus itself. So once again, it's I deserve this, it's my fault, I should have been more careful, people won't want to be with me, people will blame me, I'm not clean. And stigma and self-stigma can lead too, and this is where the problem is. People not asking for COVID testing or seeking the care they need. So they may suspect they're positive. I mean, the irony is that a lot of people are scared of going to hospitals to contract COVID, but actually they may have COVID and they may put their health at risk. But people not asking about COVID testing or seeking the care that they need is a very important consequence of the self-stigma. People hide their illness for fear of discrimination and judgment. And this is, as you can imagine, in this environment, we can't have people hiding it. We need to be able to know who the contacts are. It can lead to deepening isolation and depression. And the thing about this virus is that it requires isolation. It requires quarantine. So if you have the self-blame within it, it can deepen this. It can lead to low quality of life, low self-esteem, and anger and resentment. So what I'm going to talk about mainly today is organizational reactions to trauma, to stigma, and then also what can organizations and individuals within organizations do? And these are just some really useful ideas. So talk about COVID-19, but don't attach ethnicity and locations to the disease. So dear President Trump is not doing a good job of this by calling it the Wuhan virus, the Chinese virus. But be careful, you know, I think in the beginning, I was also, I mean, I think we all were, did you hear about that hospital with all the outbreaks? And it's not useful. I was thinking of one, and I saw an article about the healthcare workers at St. Augustine's. And they had in Durban, and they had one of the first major big outbreaks within a private hospital. And I'm a bit ashamed to say, but even I thought, oh, you know, why didn't they follow protocols? And that was me putting stigma on them, because actually it was earlier in the pandemic and they probably were doing a lot of things, but we have learned a lot more from that. The other big thing is to talk about stigma. So if people are tested positive, please normalize it, normalize the discussion. If you have family or friends or employees, you know, kind of normalize and say this is okay. Obviously there's a whole emotional aspect, but the actual concept of having it. Talk about people who have it, people who have died from COVID. Don't call them cases or victims. And then talk about people contracting it, but not necessarily infecting, transmitting, spreading. I think we need to assume that humans fundamentally don't want to harm others. I think we do need to make that assumption. And people are not intentionally infecting others. There's no blame here. Other things to talk about is to talk about what is happening, what people can do to support themselves, remind people of the measures that can help. Be compassionate and kind. So anything else will hurt someone. Put yourself in the shoes of the person, their family, their friends, and think about what you would want for yourself. And then as Aniki said in the first presentation, please share accurate information, but don't share rumors, repeat scary stories, or use language that causes fear. I think in the beginning of the pandemic, there were so much information flying around, and some of it was quite scary. I am hoping that hopefully you've blocked all of those people or, you know, those things from social media, but they really, really are not helpful, and they worsen the stigma. The next thing I'm going to talk about, which is slightly off topic from stigma. I just thought stigma was such an important topic that we have to talk about it. I think it needs to be spoken about in every workplace, in every family. I think assess if it's there. I think there's underlying internal stigmas which we might miss. We might think, oh no, everybody's fine, but I think you need to dig a bit deeper. One thing as the Healthcare Workers Care Network, one of the main reasons we set up is because we were very worried about the psychological impact of specifically COVID-19 on organizations and on healthcare workers and healthcare settings. But what I'm going to talk about here is the psychological impact of traumatic events on organizations. And before we go into that, I wanted to chat to you about why is this pandemic traumatic? You might hear this word being spoken about, and you know, as a psychiatrist, I'm actually very conservative, and I don't speak about words, such strong words such as trauma. I don't talk about them lightly. But in terms of why is this a traumatic experience? Trauma is often associated with something overtly violent, such as a car accident or shooting. The situation is traumatic when it violates familiar expectations about someone's life and world, sending them in a state of extreme confusion and uncertainty. And I think every single person on this webinar will have experienced this, that this pandemic has violated familiar expectations about what's going to happen next month. I'm actually supposed to be away on holiday, but I'm giving a webinar, which is great, but I'm supposed to be sitting on a beach somewhere. It violates what is expected. And this state of extreme confusion and uncertainty can feel and is quite traumatic, especially when there are significant losses associated with this time. Specifically back to healthcare workers, in the case of the pandemic, prolonged uncertainty compounded by the moral anguish which healthcare professionals face when they do not have adequate resources to treat critically ill patients. You can understand in healthcare workers how that can be particularly traumatic. However, I think in our society, we are all experiencing state of moral anguish, wondering about people who don't have enough food, people who don't have money, who are really, really struggling. I think it's moral anguish that you can't quantify, but it's there. And this feeling is a traumatic feeling. I was at a webinar in June 2020. It was actually on bipolar disorder, but one of the professors there, Dr. Roger McIntyre, he's a psychiatrist from Toronto. He's a very interesting person in that Toronto was one of the hubs for the SARS virus in 2002, 2003. And he was one of the first people, psychiatrist-wise, to write about the mental health impact of this pandemic. I think none of us know what the mental health impact is going to be. I think the numbers are so huge. I think we're sitting at over 20 million cases worldwide. And SARS, when I went and looked up, was only 9,000 worldwide. So you cannot compare. However, there are some theoretical bases that we are basing our theory of mental distress. And he talks about the triple threat to mental health. And there's financial stresses, there's a threat to health, and then there's social isolation and loneliness. So I think, as you can imagine, any one of these circles is enough to cause mental distress and then could lead to mental illness. So be aware that I'm making a distinction between mental distress and mental illness. I think every single person, sorry, just hold on. Hi, sorry, I think I'm back. Can someone just tell me if I'm back?
Yes, thank you. You are.
I have no idea what that was. It might have been some kind of load shedding somewhere. So as I was talking about, each of these circles themselves can cause mental distress. And that's what I was explaining, the difference between mental distress and mental illness. I think every single one of us has had some kind of stress. I think it would be probably abnormal if you haven't. I know I have. I know all the patients I treat have. My family have. I don't think there's anyone I know who's spared. Maybe a little baby might be spared, although they might pick up the emotions from their parents. So there's a direct threat to health. And this is a new infectious agent with, as we know, no vaccine. Compounded with this is because it's a respiratory virus, we need to isolate from each other. So it's not just a threat to health. It's not just when I say not just an HIV, it's not HIV in that we knew and we know how HIV is transmitted. And it doesn't require social distancing between colleagues and families and friends. And that's the major difference here. So the threat to health in combination with the distancing needed results in excessive mental distress. And then you throw in the financial stresses and the uncertainty. Due to the lockdown, many families are facing major economic challenges and job losses. What I'm going to take that into now, I'm going to talk a little bit about moral injury, because it's a really important topic, which, and I'm going to, at the end of this, I'll show you an advert. We're having a webinar on Tuesday nights where we're going to be going into unpacking this a lot, specifically in healthcare workers. But I want to explain the concept. So moral injury is the profound psychological distress which results from actions or lack thereof which violate one's moral or ethical code. Now, if we think about it, it can include acts of perpetration, acts of omission, and then experiences of betrayal from leaders or trusted others. The definition of moral injury comes from the military, and you can see how it fits in well, and it has been taken over also into the healthcare workers realm. However, I was actually thinking about our president, actually, President Cyril Ramaphosa, and I was wondering, obviously I don't know him personally, but I think this whole pandemic must have caused him profound psychological distress, because he had to take actions which would violate some parts of his being, but it looks at the greater good. And I think if we look at us as a society, we've all been in a state of moral distress. Ethical background, I mean, I think we're looking at moral injury in the South African context, and this is where we're going to unpack this a bit more next week, but are we more protected as South Africans, specifically South African health workers, because of everything we've been through in terms of our history, our previous epidemics of HIV, of TB, of MDR TB, and kind of going all the way back to apartheid? And are we more protected, or is this going to re-traumatize a whole lot of people? When we're looking at healthcare workers, there's choices between your own and family safety and that of patients. These are impossible calculations, and they can be quite traumatic decisions to make. And this is the utilitarian guidelines that may be in conflict with our first do no harm principles. So I'm thinking of our healthcare workers in the Eastern Cape. They are under-resourced, and there's too few of them. So they must be struggling, specifically in the public, but I saw that the private sector was also very full with this concept of do no harm. Relationship just to mental illness. So moral injury is not a mental illness, but I think what you need to understand is experiences of potentially morally injurious events. So remember, that's either acts of omission or acts of perpetration can lead to negative thoughts about oneself or others, deep feelings of shame and guilt, which in turn can contribute to the development of mental health problems. So if we're thinking about potentially morally injurious events, deciding to turn a ventilator off or deciding not to ventilate someone, these are issues that South African healthcare workers have been facing all along. And I suppose my question is, does that make us more immune to the effects of this trauma, or is it going to exacerbate it? So just in terms of the risk of moral injury, loss of life of a vulnerable person, once again, it comes back to leaders and organizations perceived not to take responsibility for staff. If staff feel unprepared or unaware of the emotional consequences of decisions, and I'm going to talk about that just now. If it occurs concurrently with other traumatic events, and this is, I think, what we're seeing in South Africa or all over the world, is healthcare workers are experiencing trauma within their workplace, but then they're also experiencing it at home. So they've got a loved one who's very ill, or a loved one who's passed away. And also another risk factor is there's a lack of social support. I'm going to move through this because this is specifically for healthcare workers, but this is really important. And I think this is one of the crux of my talk, which I really want to explain to you. The research does show us that most individuals do not suffer longer term psychological problems after exposure to traumatic events. And this is coming from research from 9/11, from the London bombing, from hurricanes, from earthquakes, from the tsunami. It is not saying that they don't experience significant psychological distress in the short and even medium term. But when we look at mental health, we do look at longer term psychological consequences. And this is quite reassuring. It also kind of goes with the saying, this too shall pass. We can say with relatively certainty that this too shall pass in terms of the mental distress we're feeling. The majority are likely to experience short-term distress, which will generally dissipate. However, during this time, productivity and performance may be significantly affected. And then some individuals, and I'm not going to go into this now, but there are some individuals who you can understand are more vulnerable to developing mental health problems, including but not restricted to PTSD, anxiety, and depression. The biggest group here is people who had underlying mental health disorders already, and then people who experience specific traumatic losses within this period. So what's useful? What can we do? And this is within organizations, and also, so I hope that the people, the occupational health and safety officers, what is useful? So there's three things I'm going to talk to here. Promote resilience. So this goes back to where we can't go now, is educating staff, pre-employment screening. So obviously making sure that employees you screen know what they're getting into. Preparatory briefings, and I think in a lot of the major centers, and it is hospital dependent or center dependent, depending on the strength of the manager and leader, I think a lot of preparation was done for COVID-19. I think there was at the time that there was a lot of anticipatory anxiety. I think when I last did my webinar with the NIOH, and however, that preparation has been shown to prevent long-term psychological consequences. We won't know until we know, which is afterwards. Specifically for healthcare workers, role plays or drills, talking about how to manage stress, how to manage challenging conversations and training. And the key here is compassionate, calm leadership with very, very clear communication channels. So our instinct as humans, when there's a massive traumatic event. So what I'm talking about, we're all sitting with this distress at this stage, but I'm talking about on top of that, there's a loved one who's lost someone, or there's sudden deaths. So there are sudden deaths all around us. What the research does show is it's not useful to counsel or debrief straight away. And when I mean that, I mean by a professional. So the instinct is, oh, something's happened, let's call in psychological debriefers. I think that's also out of our own desperation. We want to fix this. But I think what happens here is, if you were to phone me straight after an event, I would say to you, let's give it 48 hours. You have to allow the natural defense mechanisms to work. And what is useful during that time is very simple. And the next speaker will talk about psychological first aid and peer support and giving time out if needed. What's quite useful in this stage, what you can do if you're feeling pretty desperate, is just not even desperate, but if you want to prepare for the mental health impact, start training peers. So start training people within each team. You don't have to be a psychologist just to pick up the signs of mental distress, which are irritability, fatigue, absenteeism, presenteeism, weakness, and anxiety. And the psychological first aid approach will be spoken about in the next speaker. So these three things, so promote resilience, wait for watching, and treating those who need it. So make sure that your treatment processes are in place. You know exactly who to contact, your EAPs are in place if you have those. make sure if you're a bigger organization that you have on-site resources, or that you've got links to external resources which you can fast track. Specifically in the case of healthcare workers, and I will show the information again, but you can fast track to us in terms of any healthcare worker. Is someone answering the phone 24/7? And I think what's important to know is the further away we get from these events, the harder it becomes to talk about it. So you need to start talking about how stressful this has been, how hard this has been now, so that it becomes a normal part of conversation. One thing which is very useful, and we need to keep this in mind. This is on research based on healthcare workers, essential workers, but it is actually based on the general public. With the right organizational structure, positive emotional factors can emerge from this. Increased feelings of affection, gratitude. Remember, people and humans like to feel needed and to have a sense of purpose. Humans like to connect. The attributes of service, purpose, altruism, and courage can be encouraged now and after this pandemic. I know that a lot of people have been helping a lot, and there is what we call COVID fatigue, COVID burnout, basically. And we need to obviously remind ourselves that this is a long stretch, and like myself, I've actually taken leave now in order to recharge for the next few months. So employees need to take leave, or you need to take leave. You need to take some time out. And then there's a really nice concept of post-traumatic growth, which some people will experience. They will experience positive emotions coming through this. Looking specifically at the South African context, I think we are a unique society, and if you, as I said, I'm quite conservative, so I don't throw these terms around, but I do think we need to dig deep at this stage, focus on the underlying moral strength and the concept of Ubuntu, which is the belief in a universal bond of sharing that connects all humanity. It's to encourage moral strength despite moral adversity. And I think as South Africans, we do rise to the occasion, but it needs to be fostered and not just expected. Some individuals need to become more aware of their purpose. Remind humans, and I'm using the word humans, on the importance of connection with others. So even in webinars, chat in the chat box, you need to keep connected, especially during this time of disconnection. Express gratitude, celebrate small successes, and grant time out and breaks. So these are 4 things that you can do right now if you are working within teams, organizations, and they're free. Okay, this is the most important thing, and this is based on work from Neil Greenberg, and he's trying to put these through into the NHS, but they can be used generically. Thank people. A personalized thank you by someone senior acknowledging the work that people have done and or extra time they've put in. Consider letters to the family as well. This can foster individual resilience. So dear Joe and Jane, thank you for letting your mom come to work during this time. I know it's been very difficult. A personalized, so handwritten. The strength, the power that this has in terms of preventing psychological long-term consequences, which is my aim, is huge. Returning to work interviews. Now, obviously within big organizations, this can be an interview, but within smaller, it's literally just a check-in to how are you doing? What happened? What happened when you were away? Find out, did you go away for a funeral? Were you unwell? And also kind of talk about what can I do to get you back to work in a safe manner. Active monitoring, which is what I said earlier about the wakeful watching. Have a low threshold to intervene, the third point here, if there's no improvement 3 months after the events. So, when does the 3 months start and end? But I think you can, if someone's not visibly getting a little bit more stronger, a little bit more calmer, I would say within 4 to 6 weeks, really look at intervening and offering help. This reflective practice groups is more specifically for healthcare settings, but also for larger organizations, support groups, but led by the leaders of the organization, or the junior leaders, so the nurse, the head nurse. And these are all individual run. These are all, you know, driven from that person. So someone like myself who's got a passion to help others, and that's where the strength comes. And it's talking just about what's been going on and the narrative, and the sadness. Anyone who's interested in terms of specifically in healthcare situation, look up the concept of Schwartz rounds. They are, this is the concept of these support groups, where they put together a certain model. So just leaving with this, Ubuntu. So there is a word in South Africa, and these words are from Barack Obama at Nelson Mandela's memorial service. There's a word in South Africa, Ubuntu, a word that captures Mandela's greatest gift, his recognition that we are all bound together in ways that are invisible to the eye, that there is a oneness to humanity, that we achieve ourselves by sharing ourselves with others and caring for those around us. And it continues. This is, I think, where the core where we need to get to, because this is how we are going to come through the pandemic relatively unscathed. I'm going to I did mention that we are also running a series of webinars, and you can just take a photo of your screen if you want to register for this webinar. The next week is actually the last, and we are talking more about moral injury, which I've discussed now, and grief and loss. And with that, I'm going to stop sharing.
Thank you very much. And just a reminder, we will flash that particular advert for the session that's just been shared by Antoinette. Again, before we close this webinar, I have taken a screenshot of that particular slide. And so thank you very much to Antoinette. Antoinette runs a private psychiatric practice in Johannesburg, and very importantly, a significant resource, particularly for all health workers and frontline workers, as part of the founder and part of the co-founder and part of the healthcare workers care network. I hope I've got it right that time around. So thank you for that, Antoinette. Our next presenter is Ms. Tanya van der Water. Tanya will deal with the practical empathy. That's an antidote to stigma. And you can see the logical sequence of the presentations. Tanya is a clinical psychologist in private practice at Manzini Health Incorporated, INC. She has a keen interest in anxiety disorders and uses cognitive behavior therapy to enable individuals and groups to help themselves. And to all of you, including Tanya, I'm finding this very therapeutic, just being part of this webinar. Handing over to you, Tanya. Thank you.
Thanks so much for having me. I'm really pleased to be here with you today. I'm going to share my screen now and get started. Throughout the presentation, you're very welcome to post your Q&A on the Q&A chat box, and there are panelists at the moment waiting for your questions, ready to answer the things that you have. So I was thinking about stigma and how do we actually prevent it? How do we turn the tide? What can we do about this? And the easiest thing I could come up with, looking at the research and listening to colleagues and finding out what has worked for people on the ground, is practical empathy. So empathy is the process of putting yourself in somebody else's shoes, so that you can feel what they're feeling without making their feelings yours. You still have a healthy boundary where you know, this is what they're feeling. I can empathize, but I'm not absorbed or overwhelmed by their feelings. All right, so just a quick recap on the human experience during COVID-19. So COVID-19, as we have mentioned throughout the talks today, has been hugely traumatic at times, definitely a crisis, and we have experienced many feelings of grief and loss. So the first image I have here is a quick reminder of the grief cycle that we experience. It's a model designed by Ellen Kubler-Ross, and it gives us some handles on trying to understand what we are going through at the moment. So it's not a a linear process. It's more like a tornado. It's a bit of a mess. You might go from denial to bargaining to anger to denial to depression to acceptance and back, etc. So it's not a linear stage process that you know that you have gone through. It is messy. So just to go through these words really quickly, you have possibly heard about them before. Denial, the feeling like this is not happening. So when I received my COVID-19 positive diagnosis, no, it's the wrong result. They've mixed up the names. This is not happening. This isn't true. This is false. Denial. This is not happening to me, or it's not happening to my loved one. The next step, or the next title, is anger. So the feeling that this is unjust, it's unfair. How could this happen to me? I was doing everything right. I was following all the right procedures. I was doing the PPE. I was washing my hands. I was social distancing. I haven't been out, whatever that might be. How could this happen? So like Dr. Mirik was mentioning earlier, the virus doesn't discriminate, and it can feel really unfair when we receive a COVID-19 positive diagnosis. And these feelings are not just for when we are diagnosed as positive, but also for all the other things that have happened in the process. People who may have lost their jobs, or people who may have lost loved ones, or who may have missed opportunities. My heart goes out to the matrics who may have missed their matric farewell. So, you know, these feelings are helpful labels. It's helpful to be able to say the name of what you're feeling so that you can start to feel a bit better. The other label we have here is bargaining, that process of saying, okay, but if I do this, then this will happen. So you might start, say, praying, like, okay, God, I will pray every day if you will just make me better, or I will serve the community if you will just make my mom get better, etc. So this bargaining that's taking place, there might be a process where we feel that immense feeling of loss, the weight of the loss. And that was shared so beautifully in our first presentation, where the wolf realized that they missed, the big wolf realized that he missed the little wolf, that weight of the loss, the depression. So it doesn't have to be a clinical depression. This term here describes that sense of loss. And then finally, we also have that stage where we feel like, okay, this is bad, this has happened, but I accept it and I can move on. So in particular, today I want to focus on the COVID positive diagnosis. So you may have had COVID by now, or I'm sure all of us also know people who have had COVID, possibly even somebody who may have passed away. Remember, today with the COVID positive diagnosis, here are some practical ways that we can demonstrate empathy. So this second model that I have over here is called Maslow's hierarchy of needs. Again, I'm sure many of you are familiar with it already, but let's just apply it to the COVID positive case. So upon receiving diagnosis, all of a sudden there is a threat to your physical health, and that can be very, very scary. So if you are expecting somebody to still function at work, being able to maybe work remotely, etc., remember that their most basic need is being threatened. The other thing to remember is that they may not have access to medication or have access to fresh produce because they have to isolate and stay at home. These basic needs need to be met in order for us as a community to make a difference for a person who is COVID positive, so that they experience less stigma. The second thing is security. So some persons in your family or community or at work might not have a safe place where they could go to isolate. So this could be a meaningful way where we could intervene, have that need met so that they can feel stronger and, you know, resist the virus better. Socially, obviously, when somebody is diagnosed as positive, the person would experience a lot of isolation because they're not allowed to go anywhere. They are scared of infecting others, infecting their family, and this is specifically where we might experience a lot of stigma. So people looking down on you for having been tested positive, being shunned or punished in a social setting. And that might not just be in person, but maybe online or by gossip in the community or gossip at the workplace. The thing we really want the positive patient to experience is that they still have a sense of worth and still have a sense of value. But you can see how this is the fourth part of the pyramid, and if all those other things are not in place, the physical needs are met, the security needs are met, the social needs are met, it's going to be really hard for them to remain in that place feeling like, I am a valuable person, I am adding value to the workplace, I am adding value to the community, I have a sense of worth. So this is how we can make a difference, by meeting those other needs, helping that person remember their ego strength. And once they have met all of those needs, we can self-actualize. That's the correct term, but it doesn't fit at the top of the pyramid, so I just wrote down win. Because ultimately what we want is, we want ourselves, our loved ones, our colleagues, our communities to ultimately fight COVID-19 in this invisible battle, in this war that we are in, so that we can win and come out on the other side. So how to practically support a person during COVID-19, and again, as I mentioned before, this is specifically to apply to the COVID positive case or patient, but it could also apply to other environments and other circumstances. Psychological first aid is built on a few principles, and there are different models on how to use it, but I want to give you the basic principles with some steps to help you in this process. Remember, how you respond to somebody's story can be more harmful than the experience itself. So, for example, you might have heard of potentially a rape survivor who goes to the police station to go and report her experience or his experience, and then they find that the process of disclosure is so difficult because people don't know how to handle their stories. These tips that I'm going to share with you today is there to tell you how to respond to somebody's story, so that you can hold them, that you can support them, that they can feel empathized with. So the first step is to make sure that the person feels safe. Do they feel safe talking to you? Are you being intrusive right now? Does it feel safe to talk to you? It's a compassionate contact. You're not making contact to make yourself feel better. You're making contact to make them feel better. And so often when we reach out to people around us, we do it because of our own anxiety. So when I ask somebody about their COVID experience, maybe it has to do with what I want to hear. It has to do with my curiosity. It's not really to listen and to hold. In psychology, we have this term called containment. So to be able to hold or to contain somebody's feelings. At the workplace, we also want to make sure that our COVID positive colleague, upon return to work or while they're isolated from work, that they feel safe there, not just in a physical way. So we do those things obviously by adhering to the guidelines, etc., but also in an emotional way. Do I feel safe? Do I know that work is a safe place where people won't gossip about me, people won't shun me or condemn me or push me away when I return to work? For us as leaders, this is where we come into play, where we set the tone. We create these structures to make somebody feel safe. The next step that you want to do is to promote a sense of calm. And there are many ways that you could do this, but the one easy way to do would be to assist a person who is feeling very overwhelmed in a crisis moment. Maybe they've just heard that they are positive and you're reaching out to them. They might be a little bit hysterical or teary or overwhelmed, whatever. What you want to do is you want to deregulate the adrenal response. You want to help them to calm down, and do that through breathing. So you'll breathe in through the nose for a few counts, 1, 2, 3, breathing in. And you'll hold it there, 1, 2, 3, and exhale, 1, 2, 3. And you can repeat that with the person, not just telling them to breathe, because nobody really feels calm when somebody says to you, breathe. So rather do it with them to say, okay, I know that this is very overwhelming. Let's breathe together. Come, let's breathe in through the nose and you breathe together. You hold it there and out. And you repeat that 3 times, 3 to 9 times, depending on how overwhelmed they are. So by regulating your breathing, it helps that person to calm down so that they can think clearly again. It's not an emotional hijacking taking place in the brain. The third thing you want to do is you want to help this person to feel capable. You can do this. I know you can do this. And when you are in a crisis situation, it can feel like control has been taken away from you. So with a natural disaster, that's really easy. You know, you can't control the weather, and where you could usually just like close the door of your house and you were safe, this natural disaster took that sense of control away from you. In the same way with COVID, there are many times that we do feel like we are out of control, we are victims of circumstance, etc. So what you want to do during your psychological first aid, while talking to your colleague or your friend or your family member, is to give them back control, to say, okay, so you don't have somewhere to go right now. What are we going to do about it? So notice how you say, what are we going to do about it, as opposed to what are you going to do about it? You don't want them to feel isolated or that it's their problem. By saying we, you're not rescuing them, you're allowing them to engage in some problem solving. You want to be able to help them identify their current needs. So maybe their current need is that they need to notify their family. Maybe they need a safe place to stay in order to isolate. Maybe they need help accessing their medication. I know that many of the people on the ground that I've spoken with said one of the most helpful things that their colleagues did for them is to come and drop off medication. Just put it in the post box, because they couldn't go out to the pharmacy to get it. So what is your current need? How can we help? How can we work together? You have control here. You are capable. You're going to get through this. We are going to get through this. We are in this together. And that talks to the next point, the importance of feeling connected. And this has been challenged so much during COVID-19 because of social isolation. And obviously, when we're feeling during that isolation process, people could also feel emotionally isolated as opposed to just socially, physically isolated. So you want to make sure that they are connected. What social support vehicles are available to them, either through the community, faith groups, or support networks, etc. Social support through the family, social support through the work, etc. And also to connect them with referrals as need be. So should they need food hampers, where could they find that? Should they need medication, where do they find that? Should they need mental health care, who do you call? So you want to connect them with the resources. And as we work together as a community, which is why I love this little picture that I chose here, as we work together as a community, everybody doing just that little bit, it feels less overwhelming, because it's not one person carrying the burden for everybody. If we're in it alone, we're not going to survive. We need to do this together. And then the fifth thing about psychological first aid is to encourage a sense of hope. How to help a person feel hopeful. So it's okay to feel overwhelmed, it's okay to be distressed, and it's normal to have crazy thoughts going through your head, like I'm definitely going to die, or this is the worst thing that has ever happened to me, or this is all my fault. So, these thoughts are going to happen. What you want to do is you want to recognize those thoughts and then say, okay, let's see if there's another side of this coin, all right? So what are the stats really showing? How many people are really passing away? See, there is hope. This is scary, but there is hope. You want to show them that you can get through this. You've been through tough things before. Remember that time when we went through that retrenchment process at work and you got through that. We can get through this again. Encourage a sense of feeling hope together. So there are three different groups I would like to speak about in terms of practical empathy, how to be in their shoes. The first group is as a colleague, how can I be empathetic? As a community, how can I be empathetic? And towards children. So many of us listening today have children in our lives or grandchildren, etc. What are their specific things that they are going through, and how can we support them? So empathy as a colleague, I know Dr. Merrick touched on many wonderful pointers, which I'm not going to repeat, but I want to make a special comment here that upon diagnosis, there are things that we can do. Like I mentioned, talking about the we, how are we going to help, as opposed to what are you going to do? You want to check in. Many people have welcome check-ins. Remember, when you do check in, be it a telephone call or a WhatsApp or whatever, that check-in is based on their needs. So do the first call without them asking, and then say, would you like me to call back in a few days to hear how you're doing? So for very private people, they can decide that, that's a boundary I would like to keep. Whereas for others, they'd be like, yes, please, I'm so lonely. Please just call and give me updates of what's happening in life. Some other tips that I've heard that has worked really well is to have a WhatsApp group for people in your organization who might currently be positive. So you don't add them to the group, you get their permission. So, you tell them there is this vehicle available should you wish to talk to other people who are in a similar boat. And in this space, they can then share similar experiences, they can troubleshoot together, and it's just that sense of community. I'm not alone. I'm not the only person who's currently isolated. I'm not the only one who's currently feeling very scared. I'm not the only one worrying about my children and my parents and my work and all of these things. So that WhatsApp group is a great vehicle. I've mentioned medication assistance and fresh produce. And then upon return to work, like Dr. Merritt mentioned, that letter of thanks to the family is super helpful, and to also prepare the colleagues in advance. So the key thing in overcoming stigma is information and talking about it. So the day before a COVID positive colleague comes back to work, they're now healthy, to chat to their team, to say, what are your fears? How do you think you might feel that when this person comes back to work? This is what you can expect, etc. So you prepare the people the day before, and the day after you facilitate the reintroduction, and then during the day you do a check-in. So this has been also some colleagues in the field have also shown that this has been very helpful in their institutions and in their facilities. It obviously depends on the size of your organization. So just consider that. The other thing that Dr. Merrick's webinar series has been teaching me is the value of the REACT plan. So to have psychologically savvy supervisors who does a back to work, return to work interview. So the first thing the supervisor wants to do is they want to recognize people who may be at risk. You want to engage with that person. So it's not just something to tick off the box. You want to really engage with that person. Actively listen, not just listen so that I can respond, plan my response in my head, but really hear what this person is saying. What are their fears about returning to work? They fear the stigma, or they fear loss of income, or what are their real fears? Check their risks, specifically their mental health risk. And like Dr. Merrick has mentioned, so many people experience very traumatic events but recover naturally. So the people we want to identify here are people who are saying that they don't want to live, they're hopeless, they are so weepy and so down, they can't get out of bed, they're struggling to take care of their appearance. It's the people who show severe distress. Those are the ones we want to refer. But then having recognized this person, engaged with them, really listen to their story, assessing their risk, to help them come up with a specific plan to address the issues that they were highlighting in their return to work interview. So that's a helpful tip. As a community, appreciating essential services and appreciating those at the front lines helps the community to remember that COVID-19 will come and go. There are people fighting this battle. We are in it together, and that people who do receive a positive diagnosis, it's not the end of the world. So through engaging that constant appreciation, be it through letter writing, I was thinking to ask a group of my friends to engage in a letter writing campaign to a local hospital, just to demonstrate support, get all the children to draw pictures and say, like, we appreciate you, thank you for doing the important work that you're doing, thank you for being brave and strong and going to work every day. It can feel really overwhelming in the midst of COVID-19 because there are so many different needs. I think of how many people may have lost their jobs, the gender-based violence that's happening. I sometimes feel so overwhelmed by the incredible amount of need during this time. So instead of feeling overwhelmed by all the things that I can't control, focusing on what I can do to help. So maybe identifying one or two people or agencies or organizations within my community, I focus on them and focus on what I can do as opposed to focusing on what I can't do. So my resources would be providing training or providing therapy, etc. But everybody has resources, and that's why we need to remain connected. Somebody knows of an auntie who makes great soup at super low budget prices. Somebody knows of a person who can fix cars at a low, so to be able to stay connected so that we can help each other out with resources. Everybody has something. Everybody is holding something in their hands that we can share. As a community, it's so important that we don't pour from an empty cup. So you want to constantly make sure you are filling in, you are topping yourself up, and to to make sure that you have something to give. If you're empty, you can't give anything. And it's up to us to change the narrative about stigma, about COVID-19 stigma. So if you catch somebody talking, sharing fake news, or somebody, talking down on or shaming or shunning somebody who has received a COVID-19 diagnosis, stand up and tell them the truth, that COVID-19 doesn't discriminate, and we should not either, that it's up to us to stand together to fight the battle. Regarding children, remember, children are incredibly resilient. So should a parent or a grandparent or whichever test positive, remember that children are resilient. Children are also not stupid, so talk about it. Talk about the fact that there is this virus. Talk about it, that somebody in your family is sick. Ask them, how do you feel about it? What are your specific fears, etc. So the common fears that I've been seeing with children is that they might feel that it's my fault that mommy or daddy got sick, or that I got sick. I brought it home from school, or I wish mommy would go away because we had a fight. So the common fear about it.
A clinical psychologist in private practice at Manzini Health Inc. Incorporated, and anxiety disorders and cognitive behavior therapy is particularly her focus, also looking at individuals and groups. So we have all of our presenters available. We have approximately about another 25 minutes or so to proceed with this particular session. I just want us to have a quick look and to invite the presenters as well, Anniki, as well as Antoinette and Tanya, to have a quick look at our Q&A box. Some items have been answered there, but there may be certain key questions raised that you want to add on, or to perhaps also perhaps make a reference to any of the other presenters' points made. So maybe Antoinette, could I ask you, are there any specific key points you want to emphasize or add, or any of the Q&A questions that you may want to address at this point? Thank you.
Thanks, Ashraf. I've been answering some of the questions. I think one thing which has come up, and Tanya and I both spoke about it, is the concept of around the return to work, and the concept of a colleague is positive. How do we react? How do we support? How do we keep things confidential yet support? These are all quite tough questions. I think the cool thing is it really needs a strong or psychologically savvy leader who is talking about this stuff on a daily basis. That there are people off and then people are going to come back, and this is normal. And if anyone's feeling particularly stressed, please contact me. If you notice that colleagues, peer-to-peer colleagues are struggling, I put an answer to one of the questions where I said it's useful to say something like, I'm really finding this hard at the moment. I'm not sleeping at night, or I'm really finding this stressful. And talk about your own experiences, or talk about your family's experiences. Like my auntie had someone who passed away, and they were really struggling. So talk about your own experiences. One, it will offer support for the person you're speaking to and normalize the situation. But it also may allow that person to open up if they want to. And it's all about if they want to. The reason I spoke about the stigma and is because of this concept of the returning employee. Now, I know we spoke earlier, a couple of months ago, we spoke about returning employees, and specifically and I saw someone mention the different levels. So employees who've been working at home and bringing them back into the office. It's a culture shock. It sounds strange, but it is strange for people who haven't been in the environments. They come back and they're often quite scared. And I think that everyone who's returning into an environment, whether they're coming back from a prolonged time of virtual virtual work, or whether they're coming back and being positive. I really think they need what we call a welcome, I'm using the word welcome interview, but it's whatever you'd like to. It's a chat on their first day, giving them a call back before they come back, acknowledging that things might be hard, saying to them, this might be hard, you may be more tired, let me know what I can do. It really is about being more connected and more involved with each other during this time. That is what is going to be psychologically protective at this moment. The concept of welcome committees, it's been working very well on some of the healthcare worker facilities that we've been working with. I would really suggest that you Google it if you're definitely in a larger organization. You can kind of form a committee. I know there are millions of committees, but these are now specific committees. That welcome committee can have a plan. That this person phones them the day before and sends them a WhatsApp. Kind of like when kids move schools and then they buddy up with a new kid, kind of like that, but for that returning employee. And that's one thing actually Tanya and I didn't mention is the buddy up system at work. And it's not too late to enforce it, or not enforce, but to suggest it, to, that someone's got a go-to person. I think too often people just return to work and you've got no idea what's happened in their lives. And it really take this opportunity to promote and talk about mental health. Once the physical stuff of COVID for some people, has stopped, the mental consequences are important to talk about, and talking about them is very protective. This is the big thing. It's about talking, connecting. Hiding things is not protective. So that's quite a long answer. But.
Well, it's been very useful. Thank you very much for that, Antoinette. There's a point made by one of our attendees, Rob Rees, and Rob states, a lot of us conceal the possibility of being COVID-19 positive, and I'm adding that, he's used shorthand, because we will lose income. And so what do you suggest, what you suggest is unable to kick in? So I'm sure that seems to be a reference to a specific point, and it raises my sense as a concern about how does one deal with the psychosocial impact on colleagues and staff and employees when they have this concern about loss of income. I don't know if Tanya or Aniki wants to deal with that question. Tanya?
I'm happy to talk to that.
Go for it, yes. Thanks.
Yes, thanks. So what I have found, so as an employer myself, I have actually tried staff to share any potential symptoms, because it just places everybody else at risk when it is hidden. And I understand that unfortunately not all employers might have a similar approach, etc., and might want to, ignore COVID-19, etc. So maybe the question to ask ourselves is, would we rather deal with the guilt of infecting others by hiding our symptoms, or would we rather cope with the loss of income? And those are really, really hard questions. I'm definitely not saying that there's an easy answer there, but to specifically focus, on the impact that it's going to have on you by hiding the symptoms, and then also to become an advocate within your workplace. So refer your employer to these webinars so that they can be more informed and more savvy about the fears that an employee has at the workplace in terms of when they are symptomatic. So to become an advocate, to stand up for it, and to be part of the culture change. Those are some of the tips that I would give. So I have actually found, and I've warned my employees, that you have a higher risk of losing income or a higher risk of being fired if you come to work sick, knowing that you are sick. I would way rather that we play it safe than not. So just to make sure that what you are thinking in your head is also what the boss is thinking, because they might be more angry at the concealment than the not. So So have those conversations and become open with that. I'm thinking that possibly the occupational health specialists here at NIOH might also have special advice on this specific topic.
Yes, I mean, just to add one point, and I see there's another anonymous attendee who speaks about his or her father. The father's return, he was denied access, citing that all employees that have been booked off over flu-related symptoms can only return with a negative result. And then the attendee concludes, he went to test and the results came positive for COVID-19. I need to know how long should he be in quarantine. And so that question we'll ask our OCMED, occupational medicine section colleagues, just to answer. But clearly the point you just also made, Tanya, was that people need to be informed, and I think people need to be sensitive about these sort of aspects, but also very importantly that there's got to be knowledge on what are the benefits that are applicable in the case of normal sick leave, suspected COVID-related or confirmed COVID-related time off that people have, so that this sort of confusion doesn't lead to unnecessary psychosocial impact, as been advocated by yourselves now as presenters. I'm not sure if you want to add anything to that, Antoinette or Aniki. Okay, we've had another little of those little glitches, and my windows have all popped around the screen because of my laptop still being plugged into the. Go ahead, Antoinette. Yeah.
So I think it's a really important question by Anonymous. It says, how do I cope with stress if I'm expected to manage everyone else's? It's always expected that I need to be, strong. So this is exactly one of our strong points, and I didn't mention it enough. So I'm kind of talking about a situation where psychological resilience and good, reasonable psychological outcomes are promoted by psychologically savvy supervisors, managers, leaders. And however, I myself am a leader, and we all need support. So the leaders and managers need to talk to others. It reminds you to look after yourself. It's a free online course. You can do it at Johns Hopkins University for free. You don't get a certificate, or if you want a certificate, you pay for it. But what advice I would give the managers is upskill as much as possible, and then also take time out for yourself and model what you want. So you can't expect kind of to say to employees, you really need to look after yourselves if you're sending them messages at 10 o'clock at night. But you've got to really be realistic. But it's a real thing that managers need to look after themselves, and that's where, in terms of our network, that where a large amount of our work has gone, is to looking after the leaders and managers.
Thank you for that. Antoinette, are you still with us?
Yeah.
Oh, sorry, is it Aniki? Apologies, Aniki. I've got my names mixed up. A bit disorientated by all this load shedding interruptions here. I'm not sure because I see Aniki's.
Yes.
There you are. Thank you. I was worried that we might have lost you because I think your challenge has become a challenge here in the Braamfontein area. So, what are there any specific comments you might have? I mean, you've had a look at the Q&A as well. Are there any sort of thematic questions that are critical there, and additional comments you may want to make, Aniki?
Okay, now yeah, I'm just back, but I can make a few comments. Also for people to make a choice. Who do you want to talk to? Make sure you choose someone that you can trust. There's always a friend or a family member that you can trust with confidential information, and try to share ideas with that person, because that can maybe give you a different perspective instead of just thinking about it all the time. So choose who you want to talk to. And then if you cannot find someone in your social network that you can talk to, then one need to reach out to a professional person. And don't be afraid to do that. Make contact with a psychologist or a psychiatrist or a counselor or a spiritual counselor, someone that can that you can trust and that can assist you. Now there's many professionals that's available that can help a person. Don't suffer on your own. And also, yeah, like Antoinette said, to take care of yourself. You cannot take care of others. You will become exhausted if you don't take care of yourself, of your own diet, your sleeping pattern, exercise. And it's once again, it's those small things that we need to use because they help us to cope and they help us to stay healthy on a mentally healthy basis and a physical health basis. So you do and take care of yourself. Otherwise, you won't be able to help others.
Thank you for that. We are in the last few minutes, and I'm going to ask Antoinette just to perhaps, I did a screenshot of your slide for the session that you've invited to. If you could just quickly share that again, because in my confusion here, it seems like my screenshot has also disappeared, thanks to load shedding. And maybe that's just the opportunity for you to ask you to do that. And again, I will ask Aniki just to remind me what that abbreviation CBT is once you've done this, Antoinette. Thanks. Okay, so I'm going to ask colleagues and attendees who are watching, I'm just quickly getting my little snipping tool out here, to please just make a note of that invitation. I think the resources being offered by Antoinette and her team are critical at this time. So much of what has been shared with us now resonates with our experience, you know, trying to get things done and those late night emails that I guess I myself have been engaging in. And this session is that opportunity just to pause and reflect on some of our practices that seems to be at the moment kind of necessary, but also could be things that we would need to be so aware of and make conscious decisions about. So thanks for sharing that, Antoinette. I will post it again at a later stage. In the last few minutes, I want to just ask, I have had a quick look at the Q&As. There's nothing there that has popped up immediately for me. Okay, so without allowing for that little pause and dead air, as they would call it, a final round of comments before we conclude. I think we've covered the question here about when people who tested positive return to work quite thoroughly in the presentations and in your comments, and what to do if employer believes you're pretending to be sick after isolation period. That's both a technical, I guess, question with regard to COVID-19 regulation and medical advice. Are there any specific advice you would give around the importance of mental health when faced with such difficult questions as an employee, or faced with a scenario as a manager where one is uncertain about, I guess, the factual nature of communications from an employee? And my question probably is about, you know, Antoinette, if I could put to you, how important is that quality of communication, and what does one do when you're uncertain about having to verify what an employee and or a manager might be saying?
Yeah, I mean, I think it's very that's a very important point, and it comes down to kind of organizational protocols and structures and what's in place. My one just bit of kind of advice is, and I answered to someone just now, this, you know, it's a little bit less so, but this is really a bit of a crazy time. People are doing stupid things, and I think it's just about acknowledging that a lot of the stuff is out of fear. You know, they may be, let's say they're pretending to be sick. They may be terrified, you know, so you need to try and approach it with that in mind, but then also have your clear protocols and boundaries. You know, okay, well, we need a doctor's note to say that you're unwell. Like, be very firm and clear and gentle with what's expected, while understanding that maybe there's anxiety as well, or there's something else going on. I do think, and I've heard that some people have taken advantage of, well, I've been exposed, I'm off, I'm off again, I'm off, you know what I mean? So it really depends on the organization and the structures and the protocols, but that has to be dealt with at a higher level. But it comes down to clear communication, and then also it's important to re-establish those normal boundaries. So yes, it's been a difficult time, and yes, it's been chaotic, but it's important to no, this is our policy. Make sure the policy is informed. Make sure it's not a stupid policy, but be gentle and be clear, because everyone needs boundaries as well.
Just to add, I find that in my experience, there are very clear procedures and very clear steps on a sort of daily screening processes, and a task and role clarification and allocation rather with regard to who one speaks to, the role of the occupational health nursing practitioner and occupational medical practitioner in terms of those aspects, and clearly the role of the HR colleague in support that is provided there as well. The employee assistance program support for individual employees, as well as, I guess, additional other support that may be required by family members, is also addressed in that way. Tanya, are you with us? And maybe just a question to you. On the very same point just asked, and Antoinette has addressed on the importance of creating an environment that both maintains the achieving of the objectives of the organization, as well as dealing with the major mental health challenges that is faced. How important is communication, and ensuring that those telltale signs of the fatigue, etc., is known to those who are fellow colleagues, supervisors, and managers. Tanya?
So there are many different ways to do that. I think what some organizations have found helpful is to have an anonymous check-in system with similar to the apps that we have used to screen for COVID symptoms, etc., to have that kind of check-in system to say, this is how my mood has been in the last week, or this is how, this is how I'm doing. Like a little checklist of symptoms can be helpful. But I think, when we're experiencing psychological distress and mental health concerns, it actually takes so little to make a difference. Just being present with that person. So if you see your colleague is having a bad day, they might be a bit more weepy or grumpy and irritable than usual, just checking in to say, dude, like, I see you, I'm here for you, do you want to talk? So we're not forcing it on each other, but to say, I am with you and I can see that you're not okay, I care. So something as simple as that can make such a big difference. And to remember that, I've mentioned this in a few of the other Q&As here, to remember to focus on what we can control as opposed to those things that we can't, and with the mental health, there will be people who hide that and they don't want to talk about it. And as much as we educate and promote and try and create a sense of safety, there are those who just might not come forward, and that is not within our control. But what is in our control is that we become that safe space. So for each one of us to make that commitment to our colleagues, to our people, to say, I want to learn, I'm not perfect, I haven't arrived, I want to learn and I want to be there for you so that you are not alone. When we become those safe spaces, that is within our control. How people choose to use that, that's not in our control. So I hope that answered your question. Yeah, but
thank you.
Control, yeah.
Well, I'm very thankful. You've been an amazing panel, and I've got to hand over now, before thanking all of you again, to our executive director. That is Dr. Spo Khalamono. And I want to ask her, Spo Khalamono, to just to do the official NIOH sort of introduction and thanks at the same time. Thank you, Dr. Spoor.
Thank you so much, Ashraf. I think I'm a bit late for an introduction, so I'll probably just do some few closing remarks, and maybe firstly to thank our speakers. Thank you so much for excellent presentations. You know, the aim of our sessions is indeed to empower people out there to be able to take a leave and go back to different workplaces to impart the knowledge, but most importantly to see if they can't practice what they've learned from these sessions. And I've been looking at all the comments, and almost everybody has taken a leaf from each of you and will be able to practice what they've learned here. So thank you so much for opening up our eyes and helping us to identify factors, especially around stigma and how to deal with stigma. That was very valuable. Thank you so much. So, my plea to all the presenters is we are dealing with COVID now, but a lot is happening, especially around grieving and bereavement, which is totally different and uncultural for most of the people. And we are going to have sequelae at the end of, post-COVID, there will be problems. People would have lost their jobs, and maybe we might have to have a session as to how you help us how to cope in the new normal, which it's difficult for me to call it a normal, because it won't be normal when so many people are left without jobs, children are hungry, and people lost their houses. So I'm pleading to the panel to please avail themselves again at a later stage for us to be able to deal with other issues that we haven't been able to deal with today. So thank you so much. And Antoinette just wanted to also maybe share with the group, especially healthcare workers, that the service that Dr. Mirik and them are offering is very valuable. It's specific for healthcare workers. Please make use of the service. She has shared the link, the website, and the helpline. We need, as healthcare workers, we often tend not to take care of ourselves. Remember, I think it's Tanya who said, you cannot give what you don't have. If you don't have love, if you don't have strength, there's no way that you give it over to your patients or to people around you. So let's not forget that whether we are infected or affected, our mental health is of paramount importance for us to continue offering a proper service to all our clients. So thank you so much to you, Tanya van der Vader, and Anaki, and Antoinette. Thank you so much, colleagues. Over to you, Ashraf.
Thank you very much. So that's our Executive Director, Dr. Spoor Galamono, the overall lead that we have here and guidance within a very strong women-led team at the National Institute for Occupational Health. And I want to thank again our presenters, Dr. Anneke van der Walt, lecturer at the Department of Nursing Science at the University of Pretoria, who had collaborated with her colleague, Professor Haynes, in preparing her presentation. And then Dr. Antoinette Mirik, who runs a private psychiatric practice in Johannesburg. And I'm going to quickly share with you that slide again. You have all been invited to join the Healthcare Workers Care Network. And I hope you can all see that particular slide with the invitation, and you could quickly take a screenshot of that in order to type out that particular link for you in order to join. And you got to place that link, https that's colon, I guess, // bit.ly /HWA HWCN webinar and paste that into your what's it called, your browser, in order to join that. That invitation has happened. And so at this point, I need to say thank you then again to my colleagues, Dr. Tanusha Singh, as well as Dr. Spogala Mono, and the whole list of panelists that have been helping in answering the questions that you've placed in the Q&A section. I will again, won't mention their names now, but I will again just contact them directly to thank them for their contributions. And that's my colleagues. I just need to, I guess, unshare this particular screen here again. So on that point, thank you very much. I say goodbye on behalf of the NIOH, and we will see you on our next webinar, which we will circulate to you once we have the details sorted. So at this point, I need to just quickly share with you again the information and admin slides. A reminder to those who are interested in the certificate of attendance. The certificate of attendance will be circulated within 24 to 48 hours by the NIOH. And if you've got any questions with regard to that, please email us at info@nioh.ac.za. That is info@nioh.ac.za. Thank you for joining us. Goodbye.